Hello, everyone. I'm Cedric Peterson. I'm the Department of Communication under the Ministry of General Affairs. And on behalf of the Department of Collective Prevention Services within the Ministry of Public Health, Social Development, and Labor, I welcome you to our second edition of Ask CPS. Now, based on our national response toward stopping the spread of COVID-19, it was determined that a program that allows CPS to explain the science behind the fight against the spread of COVID-19 is critical for the public to follow. Via this program, CPS will provide a public weekly update on the current situation of COVID-19 on St. Martin, and the department would also address questions that you would send in to us via the new email address, askcps@stmartingov.org. At this time, I would like to recognize and welcome the members of our panel. In this second edition of the program, we have practitioner Dr. Grace Spencer and Dr. Samay Nattery, an internist at the St. Martin Medical Center. At this time, I would like to ask my colleagues from CPS, the head of the Department of Collective Prevention Services and epidemiologist, Mrs. Ava Lister-DeWeaver, to present her opening remarks. Ava? Ava, go ahead and start your microphone or unmute your microphone and begin.
Sorry about that. Thanks, Cedric. Good evening, everyone. Before we get into this evening's topic, I want to take the time to address a serious public health matter. Several videos have been circulating on social media where revelers took to the streets to celebrate the would-be carnival season. COVID-19 is a real threat to St. Martin, and every time persons choose to ignore the measures of social distancing, this sets us back. Doctors, nurses, and frontline workers are putting their lives on the line to fight COVID-19, and everyone should recognize the gravity of the situation. I hope that together we can take steps in the right direction to contain this epidemic. So just transitioning to tonight's episode, on this episode of Ask CPS, we will be focusing specifically our discussions on what to do if a person has symptoms. We will also address questions on COVID-19 and treatment, and ending the segment with a few true or false questions. I want to thank in advance Dr. Naderi and Dr. Spencer for joining this evening's panel, and I hope that everyone finds this segment informative. Thanks.
Thank you very much, Ava, for your opening remarks and, of course, your welcoming address. And, of course, I didn't get a chance to acknowledge we also are joined by our epidemiologist, Dr. Reisa Junkonfat. Thank you so much for being here as a part of the panel. And we're going to get right into our discussion. So, Ava, in regard to the current numbers, let's go ahead and deliver where we are in the fight against the spread of COVID-19 here on St. Martin.
Absolutely. So tonight's update will be relatively brief. So of the 302 samples that have been requested, we stand at now 75 persons that have tested positive for COVID-19.
Okay, that's the current situation as it relates to the St. Martin Medical Center. I want to turn to our internist at the St. Martin Medical Center, Dr. Samay Nattery, to give us an update in regard, again, to the numbers, capacity, and also like to make mention that Dr. Nattery is back with us. Based on the first program, we were experiencing some technical difficulties, and we realized that you were really interested in listening to what he had to say in regard to treatment, so he's back with us in this program. Dr. Nattery, it's great to have you with us. Give us the update in regard to the current situation at the St. Martin Medical Center.
Thank you very much. I will start with the current capacity that we have here at St. Martin Medical Center. We have the capacity to receive 14 patients at our pavilion. 14 patients capacity will be for the level 4 of the care, which means that the patients are in need of admission, but they are not that sick, so they do not need a lot supportive care. So we admit there up to 14 patients there. We have also 6 ICU beds at the ICU 10. There, the patients are eligible to be admitted there at the ICU 10, whereby they need the level 1 or 2 of care. What does it mean? It means that the patients are in need of ventilation support, either through intubation or non-invasive ventilation, which means that the patients need high level of oxygen by the machine. We have also capacity for 6 patients at SMMC for level 1 and 2. At SMMC, we have 8 additional bed for level 3. Beside these numbers, we have a 3 capacity or bed available whereby the patients with hemodialysis could be admitted with COVID-19 and they will receive their dialysis care.
Thank you very much, Dr. Nattery, for the update. Of course, we're going to continue our conversation in this second episode of Ask CPS on the topic of treatment. CPS wants to take the direction this time in regard to the focus on what to do if you have symptoms. Your questions came in on this topic, and the first question we would like to tackle is, what should you do if one has symptoms? This one I direct to Raisa for her response.
Thank you, Cedric. So what should I do if I have symptoms? If anyone has any symptoms, we advise them to stay home and to call their family doctor. So possible symptoms could include coughing, fever, shortness of breath, or any other flu-like symptoms. And your family doctor will then get in touch with CPS to give you further advice. But to help make sure that no one else catches the virus, it's advised to isolate yourself and avoid contact with others. So this means everyone, including family members and or your partner. So no hugging, kissing, or having sex for that matter. Lastly, we also advise you if you have symptoms to cover your mouth and nose with a flexed elbow or tissue when coughing and sneezing, and to carefully rid of the tissue when you're done, and of course to wash your hands with water and soap after.
Dr. Spencer, I want to welcome you to the program. The question we want you to tackle this in our episode is, what can a person do at home to take care of themselves if they test positive for COVID-19 and have symptoms?
Good afternoon or evening. Thank you for having me. What can you do to help yourself at home when you've tested positive? COVID-19, we have 3 categories. We have those are positive with no symptoms. Those are positive with mild symptoms. Mild symptoms are like mild fever and a slight cough. And then you have, of course, those with severe symptoms. Those are the ones who are having difficulty breathing, chest pains, etc. The ones with mild and no symptoms, we definitely, in the same category, stay home. Self-quarantine is very important. And self-quarantine also from, like what Raisha said, all the family members, especially the vulnerable groups, the grandmas and the grandfathers. Also, it's important to explain to the children that self-quarantine, this situation is important, that they don't think it's something they have done wrong, because children are also very vulnerable. Some basic things is like what Raisa said, you need a form of a mask. It can be also just like a bandana. If you have the possibility of having a mask, that would be great. If you have a house that is big enough that you can have your own room, that would be the best. But if not, and it's like, we know situations of 6 people in 1 bedroom, you have the possibility of course, contacting CPS through your GP, and then you might qualify for the so-called isolation quarantine hotel. Important is basic hygiene, washing hands, small little things that you're accustomed to doing in a family setting. No sharing toothpaste, toothbrushes, have your own waste, your own laundry, your own utilities, and if possible, also keep a distance. This, of course, creates a stressful situation. But thank God, with all the phones and all the ITs we have nowadays, you can have contact with your family, although you don't see them virtually for a good period of 14 days, or definitely until all symptoms subside. In case of situations change. You have tried all your normal home remedies that you would do with a normal common cold and flu. You're starting to feel worse. You're starting now also to show, even if it's slight symptoms of respiratory distress, so difficulty breathing, chest pain, please contact your GP urgently, because you need to now maybe go a further step. And the GP knows who to contact and which direction to guide you in. Don't wait too long when respiratory problems start presenting itself.
Thank you very much, Dr. Spencer, for tackling those questions. If you're just joining us, you're viewing and listening this episode, second episode of Ask CPS. We're going to take a short public service announcement break, and when we get back, we're going to take more of your questions as the panelists will be addressing those after the break. Stay with us.
Coronavirus is most likely to spread from person to person when we come into close contact with one another. We can all help stop the spread by keeping our distance. This means do not shake hands or exchange physical greetings, and wherever possible, stay at least 1.5 to 2 meters away from others. It's also really important to practice good hygiene, especially after being in public places. Together we can help stop the spread and stay healthy. Visit stmartingov.org/coronavirus or call 914 to learn more. This public service announcement is brought to you by the government of St. Martin.
Une épidémie mondiale a été déclarée cause par le coronavirus COVID-19. Voici quelques conseils de santé à garder à l'esprit pour vous protéger, vous et votre famille. Surveillez votre santé pendant 14 jours après avoir voyagé. En cas d'apparition de symptômes de la maladie, toux et fièvre ou sensation de fièvre, il ne faut surtout pas se rendre directement chez le médecin ou aux urgences, mais d'appeler à l'avance. Maintenir une distance d'au moins 1 mètre avec les personnes qui toussent ou qui éternuent. Si vous avez besoin d'une assistance immédiate, il convient de faire appel à votre médecin traitant ou aux urgences. En cas d'infection, informez votre médecin de vos symptômes, de vos voyages récents ou si vous avez été exposé à une personne atteinte de COVID-19. Pour davantage d'informations sur le coronavirus COVID-19, un numéro a été mis en place au 914. Cette annonce de service public vous a été présentée par le Centre d'épidémie et de la prévention et le gouvernement de Saint-Martin.
The following public service announcement brings to you a few of the many unsung heroes in the medical profession who are working tirelessly to put our needs ahead of theirs and in the midst of this battle to prevent the spread of COVID-19. Listen closely to their message so that we all can remain safe.
I'm committed to be in the hospital for you in the hope that you are committed to stay home for us. We are together in this pandemic crisis. St. Martin's people can count on me as long as you stay home.
I'm Dr. Daphne Ellis from the Collective Prevention Services, CPS. We are asking you to please stay at home.
My name is Nurse Ariane Tiar. I am a supervisor of the pediatric ward. We are here for you, so kindly stay home with your family for us. Together, we are one.
This public service announcement is brought to you by the St. Martin Medical Center and the government of St. Martin.
Hello, everyone, and welcome back to Ask CPS. This is our second edition of the program. Our guests this time in this edition represent General Practitioner Dr. Grace Spencer and Dr. Sameh Natari at the Medical Center, the St. Martin Medical Center, where he serves as an internist. And of course, my colleagues at the Department of Collective Prevention Services. In our second segment here, we want to get into the questions that you have posed to CPS. The next question we'd like Dr. Natari to tackle is, what if someone has tested positive and has severe illness? How is a patient treated in that instance?
The patients with severe illness, they definitely need admission. The patients with severe illness, usually or most of the time, they need oxygen supplement, because their own body is not, their own lungs are not capable of keeping the enough oxygen in their blood. So they need additional support. What we do here at St. Martin Medical Center is following the international guidelines, and we adapt the international guidelines on the reality of St. Martin. We are taking into consideration whether we have certain medicine available on the island. Those are the challenges whereby every island has it. So we are not exceptional in this. So our guidelines are based on our reality, based on the data published in the journals, based on the research internationally. What we are doing is in a moderate to severe ill patient due to COVID-19, we are treating them with medications such as anti-malaria drugs, such as chloroquine or hydroxychloroquine. Both of them are approved by FDA to treat certain types of malaria. And meanwhile, these medicines are registered and FDA approved to treat rheumatoid arthritis, lupus, and some other autoimmune diseases. The scientists believe that the mechanism of action of these medicines are based on anti-inflammatory aspect, as well as changing the pH of the virus itself, whereby the chance of survival of the virus is diminished or decreased. We are using also certain antiviral medications. Those medicines are basically for treatment of HIV infection. We are using certain types of those antiviral medicines to treat COVID-19 based on the results of the studies in the research done in China, France, United States, the Netherlands, and some other countries. That's why we are giving also to certain specific group of the patient the combination of anti-malarial medicine plus medicine against HIV infection. And we believe that this combination will help to decrease the shedding of the virus SARS-CoV-2. Of course, we take into consideration where there is any contraindication for those medicines. So contraindications means that a person cannot get the medicine because there is, for example, a heart condition whereby these medicines are not safe to give them. Or if a person has a liver disease, that this medicine is not these medicines are not safe to give them. And also if a person has severe renal disease, we cannot give these medicines. At the meanwhile, we are continuing with our supportive care to the patients with severe illness.
Could you explain, Dr. Nattari, thank you so much for that detailed response. One key thing we're always looking at in regard to the disease itself is getting a painted picture of exactly what you're seeing from a medical aspect with someone who has the severe symptoms. Can you explain how the disease progresses when one gets severely ill?
The disease starts usually with a mild. Not everybody gets in a moderate to severe stage of the disease. Roughly 80 up to 82% of the infected cases, they are mild symptoms. They do not need any admission, nor do they need any treatment. It will be self-limited. by symptomatic treatment, they will be fine. Between 14 up to 15% of the infected cases, they are developing moderate complaints, moderate illness. Now, those patients need admission, also need additional supportive treatment, and these patients are eligible to receive antimalarial as well as antiviral medicines. Roughly 4 up to 5% of the infected cases, they are developing, in a general population, they are developing the severe illness, whereby the admission at the intensive care is needed. Those numbers are generally accepted and published, but in our setting, we have seen more admission with severe illness because of the additional underlying diseases, such as unregulated diabetes, such as high blood pressure, which was not regulated, patients with kidney diseases, patients with cardiovascular diseases. Those are the patients who are at risk. And one of the aspects that we have seen so far here at St. Martin is at St. Martin Medical Center is the obesity, the overweight, which is associated with poor prognosis of the disease. So those patients are developing easily and in a severe stage of the disease, whereby the admission at the intensive care is needed, whereby ventilation support is needed, and in some cases, even the hemodialysis was needed in these patients. And these patients have a bad prognosis.
Thank you, Dr. Nattari. People arriving to the hospital too late, a statement that we've heard. What stage in a disease is considered to be too late?
The problem with COVID-19 is that the patients generally don't feel the shortness of breath until it's too late. What we call that is happy lung, by saying this, that if the patient is in front of you, those patients looks a little bit ill, but not that much ill. But if you measure the oxygen level in their blood, then at the beginning, we got shocked that how is that possible that the oxygen level in the blood was so low while the patient was not complaining that much about the shortness of breath. In other diseases, if a person has a low oxygen level in the blood, you will see it very easily in a very early stage that the patients are suffering from shortness of breath. But in COVID-19, that is a contrast whereby that we see a patient has a low oxygen level, even a lot more than the normal. Let's put it in that way. In a normal condition, the oxygen saturation is between 95-97% is normal. So higher than 95 is normal. But I have seen patients with an oxygen saturation of 78-79% while they were not that much shortness of breath. And I say that something is not okay. So with the time we get more experience and we see, my advice is that if a person feels unwell, the fever is not going down, the patient starts to develop weakness, diarrhea, in any types of chest pain or any types of shortness of breath, or tightness of the chest, or any change in the neurological state of the patient and the mental state of the patient, patients have to come to the hospital for admission. COVID-19 is a new disease. We know so far, we gain knowledge so far, but it's still a new disease. We have to learn a lot more. So advises, if the complaints are not improving, the patients are getting weaker or sicker, the fever is not dropping down, the diarrhea persists, abdomen pain, tightness of the chest, shortness of breath, a change of mental state, all of them are alarm symptoms, and specifically in a patient who have high blood pressure, diabetes, unregulated kidney diseases, and obesity, overweight. Don't wait. Please contact your GP, contact with us, and come to the hospital before it's too late. In an early phase, the chance of success to the treatment is higher. If a person come too late, then the chance of success decrease dramatically. And that is what we have seen so far in our patients who have been admitted and unfortunately passed away. The reason was too late, staying at home, not coming on time to the hospital, and once they were here in the hospital, it was already too late, and they had lots of other comorbidities such as obesity, blood pressure, diabetes, and those are the poor prognosis associated with poor prognosis.
Great. Thank you so much, Dr. Nattary. I want to close out this segment. We have a little bit of time left. I want to grab this last question posed to you, Ava. When a person is recovered, is there a plan to retest the recovered patient of COVID-19?
Thanks, Cedric. So at CPS, we follow the latest guidelines that are set forward by the Centers for Disease Control and the RAVM. And like Dr. Nattary mentioned, we also adapt it to our local context. So taking these international guidelines and ensuring that it fits for St. Martin and the work that we do. A person is recovered once they show no signs and symptoms. Our process at CPS is as follows. Once a person is confirmed, the team at CPS will call to follow up with the patient, and we also work very closely with the family doctor to ensure that they are also informed that their patient is positive for COVID-19. If after 7 days the person feels better and they have no signs or symptoms for at least 24 hours, they have recovered from COVID-19. So this means no fever, no cough, no runny nose for at least 24 hours. Our team at CPS also advises persons when they no longer have to stay at home or in self-isolation, and when that period can be lifted. If you have been hospitalized, though, during this period, we have adapted our protocols to advise persons to stay home for at least 14 days instead of the 7. If a person still has mild symptoms after this period, you can still spread COVID-19 to others. So we advise them to stay at home until they are truly recovered from COVID-19, displaying no signs or symptoms. And CPS will usually give advice on how to appropriately self-isolate from your family. But what's also important is that persons truly are not showing any signs and symptoms in order for us to really declare that they've been recovered.
Thank you very much, Ava, for the response to that question. And of course, Dr. Nattary, thank you. We're going to take a break and actually get into the next half of our program. We'll be tackling the Mythbuster section, the true and false, especially in the case of this infodemic when it relates to COVID-19. You can get yourself in a situation where you're probably misinformed. So let's try to debunk some of the myths that are out there concerning COVID-19. Stay with us. Ask CPS returns right after the break.
Hay un brote de enfermedad respiratoria en todo el mundo causada por el coronavirus COVID-19. Tenemos algunos consejos de salud que debe tener en cuenta para protegerse y proteger a su familia. Controle su salud durante 14 días después de viajar. Si desarrolla fiebre, tos o tiene dificultad para respirar, quédese en casa y notifique a su médico. Después de toser, proceda a la higiene de las manos y evite el contacto cercano con personas que tosan o estornuden. Si necesita atención médica urgente, asegúrese de llamar con anticipación para informar su estado de salud antes de visitar a su médico o a la sala de emergencias. Notifique de sus síntomas, historial de viaje o si cree que estuvo expuesto a una persona con COVID-19. Para información adicional, llame al 914. Este anuncio es dirigido a usted a través del Centro de Servicios Públicos por el Control y Prevención de Enfermedades y el Gobierno de San Martín.
The following public service announcement brings to you a few of the many unsung heroes in the medical profession who are working tirelessly to put our needs ahead of theirs and in the midst of this battle to prevent the spread of COVID-19. Listen closely to their message so that we all can remain safe.
Dear people of St. Martin, my name is Antonio Pantoflet. I'm the Manager of Patient Care and Education at the St. Martin Medical Center. We beg you to stay at home so in the long run you can have a happier and healthier life.
I am Shalmari Vlon, a registered nurse at the ambulance department. In the fight against COVID-19, wash your hands for 20 seconds, maintain social distancing, and stay at home.
Dear people of St. Martin, my name is Dr. Raumans. I'm a gynecologist. Please help me and my colleagues to keep our pregnant women and their unborn children safe. Please stay home.
This public service announcement is brought to you by the St. Martin Medical Center and the government of St. Martin.
Hello, everyone. Welcome back to Ask CPS. I'm Cedric Peterson alongside my colleagues at the Department of Collective Prevention Services. We want to thank you for joining us for this second episode of the program, where we're talking about COVID-19, of course, the current situation on the island. I want to get into the Mythbuster section of the program, true or false. And our first question, we have received a few of them, and we'd like to tackle them now. Does sunlight prevent the coronavirus disease, COVID-19? Raisa, what is your response to that?
So I want to respond with, you can catch COVID-19 no matter how sunny or hot it is. So we see that in plenty of other countries with warm weather, they also have reported cases of COVID-19. So you can catch it, no matter if it's nice and pretty weather outside. But again, so the best way to protect yourself is to wash your hands frequently and thoroughly, and to avoid touching your eyes, mouth, and nose, and of course, to social distancing.
Ava, is there any scientific evidence of COVID-19 being transmitted via mosquitoes?
Thanks for the question. So on St. Martin, we are all too familiar with the other viruses that mosquitoes can transmit. So we're familiar with the dengue virus, chikungunya, and Zika. However, at this moment, this coronavirus is not one of them. So to date, there has been no information or evidence to suggest that COVID-19 can be transmitted by mosquitoes. We have to remember that this is a respiratory virus, which spreads primarily through droplets. So when a person coughs or sneezes. So for right now, there's no evidence to suggest that COVID-19 is transmitted by mosquitoes.
Thank you, Ava. Raisa, if you get COVID-19, does this mean you have it for life?
So just like many other illnesses like the flu, you can recover from COVID-19. And so you will not have it for life in that respect. It's kind of like Dr. Nadri already explained. 80% of people who catch COVID-19 will have mild illness and will recover. And in fact, most of the people who catch COVID-19 recover and eliminate the virus from their bodies. So if you suspect you might have it, as has been previously been discussed, get in touch with your family doctor as quickly as possible.
Thank you very much, Raisa, for your answer. There are rumors, Ava, circulating that CPS nurses are going house to house, testing people are sick and not opening the door for them and to speak to them through the window. Can you address this?
Yes. So this rumor has been extremely disappointing and disturbing to hear, quite frankly, mainly because these nurses have been working tirelessly on the front line over the past few months. They are professionals who have been trained and adhere to the safety first principle. So safety to protect themselves, safety to protect their families, and safety to protect the public, which includes wearing the necessary protective equipment. So the mask, the gloves, the gowns. And the nurses also know that if they are sick and develop any flu-like symptoms, to stay at home. They would never jeopardize the health of themselves or their families or the public. And so I hope to squash this rumor, because they have been tirelessly working, day in, day out, and they are truly professional and conduct themselves in a professional manner. So, I can attest to that fact personally. They've never, fortunately, come to work sick, and they are familiar with our protocol that we set the same expectations of them as we do for others if they are sick to stay at home. But in the last few months, they have come to work, gone above and beyond, and safety first. They would never jeopardize that. So I can say with confidence that my nurses are healthy, and they maintain adhering to the professional scope that they work under.
Thank you, Ava. Raisa, local home remedies, do they help in preventing you from getting COVID-19? True or false?
So, no. So far, there's no evidence that any home remedy will stop you from being infected with COVID-19. This is something we already discussed also last week, saying that staying healthy is always a good thing. So feel free to have a cup of bush tea. However, the best way to avoid getting COVID-19 is by social distancing and washing your hands with plenty of soap and water.
Taking a hot bath does not prevent the new coronavirus disease. Raisa, true or false?
A hot bath will not prevent you from catching COVID-19, so no. And of course, we advise anyone to avoid extremely hot water, because no one enjoys burning themselves. But again, as I was saying before, the best way to prevent COVID-19 is by social distancing and frequently washing your hands with water and soap.
Thermal scanners. Everyone has seen the videos of individuals that are in transit points being tested or going into stores. And based on my personal research, these particular scanners are kind of expensive. Are they effective, though, at detecting people infected with the new coronavirus?
So I will say thermal scanners are effective in detecting people who have developed a fever. And I know in the beginning there was a big push, for CPS to take temperatures of everyone coming into the ports and the airports. But again, it's only testing someone at a moment in time. So, even though we're testing someone at a moment in time, it can't detect people who are infected but are not yet sick. So it's very labor intensive and cumbersome just to have a snapshot of a person's health at one point in time, or a person's temperature rather at one point in time.
Thank you very much, Ava, for the response. That pretty much covers all the questions in our Mythbusters sections, true or false. We're going to take a very short break and come back to get the closing remarks from our epidemiologist and head of CPS, Ava Lister DeWeaver. Stay with us. You're watching and listening to Ask CPS.
Gen yon maladi nan le monde entier ki rele coronavirus ou bien COVID-19. Li bay problème respiratoire. Sa pou n'kembe nan tèt nou se ki jan pou n'proteje tèt ou ak fami ou. Kontrole santé ou pendant 14 jou si nou te voyaje kite peyi ya. Sou vin développer la fièvre, wap tousse ou bien gen difficulté respirer, rete la kayou pas sorti. Rele docteur sou gen numéro téléphone docteur. Pratike façon hygiénique pour tousse ak pour laver main. Évite entrer en contact avec moun kap tousse ou bien kap esterne. Sou gen nécessité assistance médicale, rele avant. Explique docteur ou bien département urgence lan ki jan ou senti ou. Explique yo si ou te voyager. Explique yo si ou pense ou te rentre en contact ak yon moun ki peut-être te exposé à virus la. Pour plus d'informations, rele 914. Annonce publique sa soti nan santé, contrôle ak prévention maladie et gouvernement Saint-Martin.
The following public service announcement brings to you a few of the many unsung heroes in the medical profession who are working tirelessly to put our needs ahead of theirs and in the midst of this battle to prevent the spread of COVID-19. Listen closely to their message so that we all can remain safe.
Hello, my fellow St. Martiners. I am Nurse Carty from the Ambulance Department. We are now facing a very crucial time. Please adhere to the instructions given. Follow good hand hygiene, social distancing, and please stay at home.
My name is Angelo Martina. I'm one of the supervisors of the emergency room. Let's fight this. Stay home.
I am Dr. Sameh Nadari. I am internist at St. Martin Medical Center. I am here for you. I am at work for you. So please stay at home for us.
My name is Andrele Ellis, pharmacist of KL Pharmacy in the St. Martin Medical Center. Please stay home.
This public service announcement is brought to you by the St. Martin Medical Center and the government of St. Martin. There's an outbreak of respiratory illness worldwide caused by the coronavirus COVID-19. Here are a few health tips to keep in mind to protect yourself and your family. Monitor your health for 14 days after traveling. If you develop a fever, cough, or have difficulty breathing, stay at home and notify your house doctor. Practice cough etiquette, hand hygiene, and avoid close contact with people who are coughing or sneezing. If you require urgent medical care, be sure to call ahead before going to see your doctor or to the emergency room. Tell your healthcare provider of your symptoms, travel history, or if you think you were exposed to a person with COVID-19. For additional information, call 914. This public service announcement is brought to you by the Centers for Disease Control and Prevention and the government of St. Martin.
Hello, everyone, and welcome back to our final segment of the program. I want to thank you so much for tuning in and being a part of Ask CPS in this second edition. At this time, I'd like to ask the head of CPS, of course, and our epidemiologist, Mrs. Ava Lister DeWeaver, to present her closing remarks. Ava?
Thanks, Cedric. First, I want to thank Dr. Nadari and Dr. Spencer for making themselves available on this evening's panel. The work relationship that we've developed over the past few months has been incredible, and I can speak on behalf of my team that we value your insight and perspectives daily, especially when it comes to COVID-19, so thank you for that. I wanted to just highlight on next week's episode of Ask CPS, we will be discussing the epidemiology and highlighting some of our data findings and providing additional information on how CPS conducts contact tracing. I would like to reiterate to viewers and listeners the importance of adhering to social distancing measures, such as avoiding crowds and mass gatherings. This has been an extremely important intervention in curbing the spread of COVID-19, and this is being done for your health and your family's health. If you are experiencing flu-like symptoms, do not wait to call your doctor. If you need more information on COVID-19 or if you have questions on CPS's community initiative or any of the work that we do, please call 914. We have also launched our Ask CPS email address that Cedric alluded to at the beginning of the series, askcps@stmartingov.org, where you can send any questions or concerns that you may have so that we can address them at this platform. And I thank you for your time, and I look forward to next week's session.
Thank you very much, Ava, and I'd like to thank our guests for joining us in this edition of Ask CPS. And to our radio listeners, televiewers, and online viewers, thank you for tuning in and being a part of the program. If you've missed it, of course, be sure to log on for video on demand at the official Government of St. Martin Facebook page. That's facebook.com/SXMGOV. Be sure to subscribe to the official YouTube channel of the Government of St. Martin. And also, be sure to tune in to St. Martin Gov Radio 107.9 FM for the rebroadcast of the audio version of the program. On behalf of my colleagues at the Department of Collective Prevention Services, and of course my colleagues at the Department of Communication, I want to thank you so much for tuning in and being a part of the program. Be safe, St. Martin, and we'll see you again for the next edition of Ask CPS.